Hemorrhoids are one of the most common anorectal disorders affecting millions of people each year, yet they remain a topic many feel too embarrassed to talk about. Despite how frequently they occur, misconceptions about hemorrhoids exist. These swollen veins in the lower rectum or anus can range from mildly uncomfortable to severely painful, and if not managed properly, they can impact everyday life and lead to chronic issues. Let's take an in-depth look at what hemorrhoids are, how they develop, the different types, symptoms, causes, and treatment options, both medical and natural. We'll also explore lifestyle changes that can help prevent future flare-ups and promote long-term anal and digestive health. Number 1, what are hemorrhoids? Hemorrhoids, also known as piles, are swollen and inflamed veins located in the rectum or around the anus. They are similar in nature to varicose veins, which often develop in the legs. Hemorrhoids occur when there is increased pressure in the lower rectum, causing the veins to swell and stretch. There are two main types: internal hemorrhoids, which occur inside the rectum and are usually painless but may bleed, and external hemorrhoids, which develop under the skin around the anus and are often painful, itchy, and swollen. In some cases, hemorrhoids can become thrombosed, meaning a blood clot forms inside them, leading to extreme pain and inflammation that may require medical attention. Number 2, what causes hemorrhoids? The root causes of hemorrhoids are typically related to increased pressure on the veins in the rectal area. This pressure can result from a variety of factors, including chronic constipation, prolonged sitting on the toilet, straining during bowel movements, heavy lifting, obesity, pregnancy, and a low-fiber diet. These habits and conditions lead to sluggish bowel movements and increased abdominal pressure, which in turn places strain on the veins in the lower rectum. Over time, this pressure causes the veins to bulge and form hemorrhoids. Genetics can also play a role, meaning some individuals are naturally more predisposed to developing hemorrhoids than others. Number 3, common symptoms and how they present. Hemorrhoid symptoms can vary depending on their type and severity. Internal hemorrhoids are often painless but may produce bright red blood during or after a bowel movement. The bleeding is usually noticeable on toilet paper or in the toilet bowl. Because these hemorrhoids are often located in the rectum, you may not feel them unless they prolapse or protrude outside the anal opening. External hemorrhoids, on the other hand, can be very uncomfortable. Symptoms include swelling, itching, irritation, and pain around the anus, especially when sitting. In the case of thrombosed hemorrhoids, you may notice a hard, painful lump near your anus caused by a pool blood clot, which may require drainage or minor surgery. Number 4, diagnosing hemorrhoids and ruling out other issues. If you suspect hemorrhoids, a physical examination is usually the first step in diagnosis. Your healthcare provider may conduct a visual inspection of the anal area and perform a digital rectal exam to check for abnormalities. In the case of internal hemorrhoids and anoscopy, a procedure where a small lighted tube is inserted into the rectum may be used to get a better view. It's important to seek medical advice, especially if you notice rectal bleeding, because symptoms of hemorrhoids can sometimes mimic those of more serious conditions like colorectal cancer or inflammatory bowel disease. Early diagnosis ensures appropriate care and peace of mind. Number 5, treatment options, from at-home relief to medical procedures. Treatment for hemorrhoids depends on their type and severity. Mild cases often respond well to home remedies such as warm sitz baths, over-the-counter topical creams or ointments containing hydrocortisone, and the use of witch hazel pads to soothe itching and inflammation. Pain relief can also be achieved with ice packs and oral pain relievers. For more persistent or severe hemorrhoids, medical procedures may be necessary. These can include rubber band ligation, where a small band is placed around the base of the hemorrhoid to cut off blood flow, sclerotherapy, which involves injecting a solution to shrink the hemorrhoid, and in some cases, surgical removal is necessary. Newer, minimal invasive procedures like laser therapy have also become increasingly popular due to shorter recovery times. Number 6, natural remedies and holistic approaches. In addition to traditional medical treatments, many people turn to natural remedies to ease the discomfort of hemorrhoids. Aloe vera gel, known for its soothing properties, can be applied directly to the anal area to reduce inflammation. Coconut oil offers antimicrobial benefits and acts as a gentle moisturizer and lubricant. Epsom salt baths can provide pain relief while helping to reduce swelling. Internally, dietary changes are critical. Eating more high-fiber foods such as leafy greens, whole grains, fruits, and legumes helps soften stools and reduce straining. Hydration is equally important. Drinking plenty of water supports healthy digestion and regular bowel movements. Herbal teas like chamomile or dandelion can also support digestive health and reduce inflammation naturally. Number 7, preventing hemorrhoids through lifestyle changes. Prevention is key when it comes to hemorrhoids. One of the most effective strategies is adopting a high-fiber diet and promoting regular and easy bowel movements. Fiber adds bulk to stool and helps it pass through the digestive tract with less strain. Regular physical activity is also beneficial, and it stimulates intestinal function and helps prevent constipation. It's important to avoid sitting for long periods, especially on the toilet, and to respond promptly to the urge to have a bowel movement rather than delaying it. Using a footstool to elevate the feet while on the toilet can help align the body in a more natural position for easier elimination. Additionally, reducing stress through mindfulness or yoga can improve digestive regularity and reduce flare-ups. Number 8, when to see a doctor. While many hemorrhoids can be managed at home, there are times when professional medical care is essential. If you experience persistent bleeding, severe pain, or symptoms that don't improve with home treatment after a few days, it's time to consult a healthcare provider. If a thrombosed hemorrhoid becomes unbearably painful or shows signs of infection, such as fever or pus, immediate medical attention is needed. Chronic hemorrhoids that interfere with daily life may require surgical intervention. Always take rectal bleeding seriously, as it can sometimes be a sign of other gastrointestinal conditions that require a different course of treatment. Hemorrhoids may be uncomfortable to talk about, but they are an incredibly common condition that many people face at some point in their lives. Understanding the causes, symptoms, and treatment options can empower you to take control of your health and find relief. From simple home remedies to professional medical procedures, there are many ways to manage hemorrhoids and prevent their recurrence. Most importantly, adopting a lifestyle that supports digestive health through fiber-rich foods, hydration, movement, and stress reduction can dramatically reduce your risk. If you're experiencing symptoms, don't ignore them. With the right knowledge and support, you can relieve discomfort, heal effectively, and regain your quality of life.